The Dougherty Hospice House has been in Sioux Falls for over 15 years, and manager Cathy Kellogg has been there since its construction. Its main purpose is to house patients who are living their last 30 days of life.
So we take quite a few people from the hospital in the intensive care situations, or patients that are in the hospital maybe with a cancer diagnosis where there's no longer treatment and maybe their family's not able to care for them at home, so they can make the choice to come here to the hospice house.
Kellogg says a referral isn't needed if a patient decides to come to the hospice house. She also says patients are assisted with any care they require.
Once they come to the hospice house, no matter what their care needs are, they do not have to go back to the hospital. We do things like running narcotic drips, doing difficult dressing changes, wound care. Those sort of things are all managed by expert RNs and our aides, and so it all can be taken care of right here at the hospice house.
When patients come to the Dougherty Hospice House, they arrive to a 2-suite room with a bedroom and a family room. Kellogg says people can come and go from the rooms as much as they want, and she says the staff focuses on what the patient's goals are and intensively care for them.
So we intensively care about what it is that the patient and family want, because they're always going to remember this final journey. And so we really want to ensure that what's important to them, that we're able to provide that.
Kellogg says the Dougherty Hospice House is meant for patients and family members to be connected again, and not have family members focus on being caregivers.
When families come here, first of all, they know that they're going to get the pain meds they need or the extra attention they need, and that they really don't have to be the caregiver. They really can be husband, children, and family and friends.
And while it can be sad to see loved ones in hospice care,
Amen.
Kellogg says there's a lot of living going on to celebrate the final part of life.
There's a lot of living that's done at the hospice house. Sometimes you might think that you come to the hospice house and it's all sadness, but what you really will see is our volunteers doing things with patients and families, or sitting in the dining room and having our cookies, which is kind of our signature. There's always usually cookies baking, and there is a lot of laughter, there's a lot of storytelling, there's a lot of just sharing the important stories of their life that they want to leave as their legacy.